Hi, welcome back everyone. I'm going to hand back over to the workshop facilitators to discuss the thoughts that have arisen in the various workshops. So whenever they're ready, if the workshop facilitators could turn on their cameras whenever they're ready, and we'll share some thoughts.
The Young Person's Guarantee, which is currently in our programme for government in terms of Welsh Government's commitment to what it's going to deliver for Wales. And if you're not familiar with it, it is a commitment that talks about support to get into employment, support to get into self-employment, help to access a training place or an educational place. So that is on the face of what the commitment is all about. It's targeted at those that are 16 to 24-year-olds. But generally, it aims to support those outside the labour market that are struggling to get inside the labour market, which traditionally have been called NEETs, not in education and training, but could be a change in demographic as we move forward, as COVID, as we know, has acted as a massive disruptor in the labour market. So we had a really, really good discussion in two groups. To summarise, everybody really felt that opportunities around work experience was really highly valued, not only by individuals, but also by employers. There was a lot of discussion about Kickstart being a wonderful opportunity for Wales, as it has been across the UK. But what would happen after Kickstart finishes, which is planned for December? What next? We should be factoring into our plans in terms of the youth guarantees some sort of work experience approach that has a similar characteristics to the Kickstart programme. So that came through really loud and clear, if I'm honest, as one of the first topics that really all the group agreed on. The next thing that came forward was how we ensure that we provide through this new guarantee relevant and appropriate opportunities. Now, it's very, very hard to guarantee a job, isn't it? Employers recruit against their recruitment practices and against their qualifications stipulations, and they have a lot of people to choose from in the market at the moment. So we had quite a bit of debate about that employment element of the youth guarantee. We had a bit of a discussion about is any job better than no job? Or should we insist on it has to be a good job with the good characteristics of good work that we've talked about today? We also talked a little bit about the reality of such an offer to such a wide group. And that whatever we do not just provide advice and guidance. We have to have very practical interventions that actually help and support people, that actually do something to help people into one of those options, or provide the options of training, of employment, of self-employment. A real offer came through quite strongly as a key message for us. There was quite a little bit about how we ensure parity on transition points where young people are either coming out of school, or they're coming out of a job because they've lost their job, or they're coming out of further education or higher education, or they're just lost to us completely in terms of they're the most hardest to reach. And how do we, in that transition point, really get parity of esteem on some of those offers? The academic route is not for everybody, but people tend to be funneled down that one particular area. And how do we ensure that the perceptions change on things like apprenticeships that have excellent returns, and that linked through to the job adverts that employers are putting out? Should they actually have experience, apprenticeships, rather than some of the degrees and master's degrees that they're asking for at the moment? So there was a big piece around parity of esteem, perception and transition that underpin that, making this a real offer, which we hadn't thought about previously. So that was really helpful for us to think about those issues again. quite a big feel around local structures and how we work with getting the right choice using what's already been proven, young persons' youth engagement and progression frameworks, and also the 14 to 19 pathways, which has been local authority driven. It's been linked to local areas. It's all about choices for individuals. And there's a sort of independent learning coach and careers that are involved in that space that help people understand what options there are and how they can move forward. And of course, that is, again, in the local space, how you reach out into communities to those that, you know, we find that harder to reach, harder to get into the mainstream system. If we need to do anything, we really need to make a difference on the protected characteristics in terms of uptake on skills, uptake on programs, and uptake in employment. There's a bit about, you know, we need to open up a bit on a national conversation with the public sector. We really need to throw our arms open in terms of collaboration on the young persons guarantee. And that is, you know, public sector are an amazing safe haven for young people. They can value and empower young people to recognise their own skills and strengths and give them that wider networking connections that they will need for their future career. And it's also their civic duty to step in and try and support us during this time. I think, you know, a real open and collaborative approach is needed through that sort of national transparent conversation. And I know our minister is open to that already because he has discussed that with us. So it's great that that's sort of aligning. Innovation came through as well. We really, really need to think about the family-linked solutions, not just you know, targeting individuals, but how we embrace the whole family approach. We know that intergenerational unemployment has been a huge problem in certain parts of Wales, and how we embrace that. And that particularly is for, you know, young mums and parents and childcare responsibilities, and how we lock into that whole system to think about a family approach. There was a little bit more about where are the jobs, you know, where are the labour market opportunities, where are the higher end, higher value jobs in the future, where's our intelligence on that, and how we can use our regional skills partnerships. And then on the flip side of that, there was a bit of a discussion about, well, you know, what do young people enjoy doing? Are they those types of jobs? What shouldn't we be providing a more balanced approach about what actually motivates young people? You know, they're tech savvy, they're eco warriors. Should we be thinking much broader in that space? And there was a piece that was about the transition from young people through a lot of these options is about getting them into the labour market, whether that be self-employed or employed. But when we get them there, we need to think about how we continue that support, how we nurture those people, how we develop a lifelong learning culture around those people, how we get more of a mentoring type of approach with those people. You know, dare I say, a sort of apprentice type of approach where we are handing knowledge, expertise on to the next generation. But also to do that, we need to reflect ourselves on how much training we allow ourselves to do and how much latitude we give ourselves to allow that knowledge transfer and that nurturing to take place. And that's quite a cultural space and a cultural development, I think, for us, but one that, you know, is needed, because once they're in employment, we want them to continue to be nurtured towards their future aims, goals, and to support society. So that's whistle stop to where everybody said, I think. A bit more than 3 points. Sorry. Thank you.
Thank you. Yeah, I guess if any of the other workshop leaders would like to share some thoughts as well. Claire, if you're happy to discuss.
Yeah, I'm happy to go. Okay, so our workshop looked at the range of factors that contribute to good work, with a focus on health and wellbeing aspects and the characteristics of creating a physically and mentally healthy place environment. So workshop 1 looked at the policy environment in Wales, and we had some really good discussions. We acknowledged that there is a really good policy context and environment in Wales, but as with everything, there is room for improvement and we can do better. So we looked at identifying some of the barriers and also the enablers and levers for employers on the ground. So I won't go into too much detail, so I'll just summarise some of the key discussions. So some of the key things coming out was that there was an unrealistic expectation on occupational health, and that ideally occupational health needed to be mainstreamed into primary care provision, and that it would be a proactive provision, so that we wouldn't wait until somebody was off work before that service kicked in, that it would be a proactive service to catch these people before they fall ill. Some of the other barriers that we identified were that some businesses were still working in silos. There was a lack of sharing of good practice, so that resulted in lots of duplication and wasted resources. And in some cases, very limited resources would be wasted. That some businesses found it difficult to adapt, and particularly to the issues that we've had recently with the COVID pandemic. Cultural, political, and for some still a lack of knowledge and awareness of what good employment looks like and what is good work. So those, I think, I've summarised some of the key barriers. So in terms of enablers, we felt that, sorry, let me just get my list up. So in terms of enablers, we felt that going down the Social Value Act was a really good route, and it would demonstrate how good employers can impact positively upon the community, and we felt that would be really good buy-in, particularly for young people who are really interested in these employers that go over and above. We felt that gaining the recognition for these good employers would also be a good hook to get them involved in this type of work. And a key one for us was procurement. We felt that health and wellbeing embedded into contracts for large public sector organisations like the Welsh Government, like local authorities, like the big health boards, the anchor businesses in Wales, where they would ensure that any business that worked with them were working in line with the principles of good work, was a really good way to filter these good messages across the whole of Wales, really. So yeah, that was our levers and our enablers. So moving on to our activity 2. So activity 2 looked at what resources and support did employers need to look after the health and wellbeing of their staff in Wales, and some of the key findings. So I think something that came across loud and clear was that ideally there would be further investment from the government to create wellbeing posts, because we felt that for some larger organisations who were lucky enough to have a dedicated health and wellbeing resource or a dedicated team to look after the wellbeing of their staff, that they were really well placed. But other organisations saw these roles as an add-on, so they felt that further investment either directly into the business or a shared resource with a number of different businesses would be really welcomed. We felt that it was really important for businesses to keep on top of the key challenges and issues affecting their workforce. So if there was organisations who could provide them with those sources of information, updates on surveys and data, then that would better place them to be able to cater to the needs of their workforce. Signposting and providing the businesses with information on local support services that they could access was seen as something that would support them. Another key theme that came out was the important role of management and effective management, and even more so now with the recovery from COVID, with the shift to remote working, and how managers may not be equipped to be able to support the health and well-being of the needs of a remote workforce. So support and resources and training to support that is something that was seen to be welcomed, as well as some directions and instructions in terms of evaluation. So how does the business demonstrate the impacts that they are having? What evidence do they look at? What data do they collect? How can they see how effective they are at supporting the health and wellbeing needs of their workforce? And then finally, again, for organisations to be supported with an implementation plan to health and wellbeing and good work, and again to demonstrate the progress that they are making. So I think that sums it up. Thank you.
Thanks. Is Kieran there to talk about the other workshop? Hi. Oh, I think you're on mute, sorry.
So I am. Thank you, Ethan. I'm glad you're setting me right here already. Yeah, we had quite a wide-ranging discussion on what could be done locally and regionally, and particularly what's already working well and what we can on. A strong theme from the discussions was about success factor being co-production and collaboration, and the importance of working together with particularly private sector, policy and communities to shape what our interventions and what we do. The role of employers actually came out quite strongly in this discussion as well, in terms of creating healthy workplaces and the need to simplify a complex landscape for employers, and particularly some of the smaller employers who may not even have dedicated HR managers, to make this all a bit easier for them to understand. With that as well, I think, was recognizing that as employers ourselves, are we doing the best to make our conditions good work for the people working in teams here around control and autonomy and ownership of pieces of work. Another success factor was the kind of local view. So recognizing that if you create a local place that is a healthy place and a good place to be, you can attract skills and infrastructure and promote good work and good health. So as that place-based view came out, as well as the fact that if you reinvest locally, that local pound can create social value. And so your contracts can form almost a virtuous circle there for improving health and good work. There were some very particular examples of models that seemed to be working really well. So one of them was Communities for Wales Plus, where instead of having just someone who's struggling gets a 10-minute kind of chat and bit of advice, we heard how a particular individual who, in this case, in our scenario, was who was looking to change career due to COVID. Actually, someone just like our scenario had gone through Communities for Wales Plus, had been upskilled in their main profession, had access to special childcare provision through PACE, had also had new skills developed, and is now working in a childcare environment themselves. So it's a really positive example about how some of that was run through a local authority. Some of that on the ground work is making a big difference. Healthy Working Wales was also another example that was cited, including the Platinum Gold Award, which encourages people to take on those with learning disabilities, so that you're not just aiming at those particular sectors of market, but you're giving opportunities all across the board. And Well North Wales was another really good example, which is very community focused, addressing poverty, social prescribing, had COVID-19 hubs for debt advice, and that was a really important example of that community approach. And in terms of the kind of what else can be done, one point was that those who are precarious workers may have difficulty, for example, getting mortgages due to being unable to demonstrate their income. So there are opportunities to underwrite some of the challenges that they have. So to look a bit differently at some of the challenges that these people are facing in relation to their employment conditions. And then also that community approach and getting back to face-to-face. So trusting the small multi-sector partners to work together and to deliver. But also there's been real experience of young people who have suffered majorly with isolation and anxiety, have not wanted to even engage in a video call, but want to do it all via chat and text. Actually going back into the community, going back face to face to overcome some of those hurdles and really engage was felt to be an important next step.
Thank you.
Okay, I mean, that is pretty amazing. I'm not sure how Ethan and I will, in the next few minutes, try to put all those different strands together, because that is so rich, but that is the task that we have in hand. I mean, we've really heard how the quality and security of work, the conditions we work in, determine our mental, economic and social well-being, and also define the economic performance of private and public sector. But it's not just about a particular time in life for young people, it's across the whole of life. And good work is a public good, and good health is an input into that good work to deliver public good. One thing that strikes us, and Nathan and I were talking about this earlier, is that age and experience should not define if we have the access, the opportunity and security of good work. And that has been the experience of many young people. So actually on that, I'm really going to hand over to Ethan for his kind of reflections. As someone who's been in and out of work and has participated in this process today. So Ethan, over to you.
Yeah, so I've experienced firsthand what it's like to be out of work for a long time, especially after my particular situation was I went through, I did A-levels in university and really put the effort in and still couldn't seem to find any jobs. Yeah, so the sense of isolation really does get to people, and I know a lot of my friends were in the same situation as well. And the idea of not all work is good work, that's quite a big thing. Like a lot of I've been quite privileged in the sense that my parents have been happy to have me living with them so that I don't have to worry about rent and things. But other friends my age, they haven't really had that, and they've had kind of no choice but to end up in a full-time job in something that they really don't like. And often kind of entry-level things where they don't seem to have been treated that well. And sometimes getting into that kind of job can feel more like doors closing rather than doors opening. I get the impression sometimes. So I feel I've just been so lucky to have ended up on the Kickstart scheme, really. Because, yeah, I think it's just perfect for people like me who, obviously it's aimed at a range of people. Some people like me might have got various qualifications, and other people, they maybe haven't even got any qualifications, but they would still have so much to offer to a workplace if they were given the chance and the opportunity to develop. So I just feel really lucky that I've been able to end up on a job that seems to put my well-being and my development first. So hopefully I've been able to, I guess, give some value to the workplace as well, but it's a two-way thing where I've definitely got so much opportunities back for myself to develop myself as well. So yeah, I guess with the Kickstart schemes, I think they're ending in December, I believe. So I think it's been such a good thing that I guess just for future opportunities for there to be more similar things similar to the Kickstart scheme, I think would be a really, really great thing. Probably for older people as well, because if I was just 2 years older, I wouldn't have been able to get onto the Kickstart scheme. I'm sure there's plenty of people who are older than 25 who haven't been able to get any experience for whatever reason, who probably benefit from things just the same. Yeah, one thing I talked about briefly as well earlier, quite like the I don't know, I sometimes wonder if there should be more part-time opportunities for work, partly because if people my age, some people are trying to get started as doing freelance stuff as well, or they just want to keep options open. I think part-time work can be a really great thing where people can have the opportunity to do education activities alongside their jobs. When I was applying for things, I always got the impression that the vast majority of part-time roles were always in things like retail, which obviously they can be really great for some people, but I feel so part-time roles in more office-based jobs, if that's, I'm not sure if that is a possibility, but that kind of thing could be really great, because that's exactly what my job has been, and it's been really perfect for me. Yeah, that's probably everything. I just want to say that as a young person, I think it's been really encouraging to hear all these discussions and to hear all the various plans, I guess, for the future. It is really encouraging to hear. Yeah, I'll hand back over to Chris.
Thanks, Ethan. And I think that, I mean, for me, what's powerful about today is the fact that young people are at the table sharing their experiences, positive and negative, and shaping the dialogue and the discussion for how we go forward. So just jumping off that, I'd like to maybe make 5 broad summary points and then some very practical details at the end. And I know we don't have very long, so I'll try not to speak too quickly. I mean, when we look at the link between this morning and this afternoon session, what we've seen is the direct link between good work, good health, good work is there. It's clear, and we can see that it's not just for a few people. It becomes a foundation for healthier society. So the indirect effect in terms of stronger workforce, stronger human capital, community well-being, better, stronger inward investment, we see then that the good work, good health, they're two things that need to go together. And if we do that, we get individual economic and social resilience. So I think that's something that the conference has shared, and I think that's something that we need to make very clear in how we go forward. The other thing that I heard through the day, but particularly in the feedback sessions this afternoon, is that we have to see good work as we see good health, as really looking at pathways. So we know that not all young people are the same. They don't have the same background, experience and aspirations, but that shouldn't define whether they have good work and good health. So we need to look at good work and good health in terms of what are the pathways into good work, what are the pathways from good health to good work, and vice versa. And that means that we need to not see this as a one intervention or one project. It requires, let's say, a basket of interventions. And because not all young people need the same things, we need to be able to personalize that. And we need supportive foundational activities like universal basic services that support young people into work, pathways through and into decent work over the lifetime. And I think that one of the great tools that you have is the work on the Welsh Health Equity Status Report that's bringing forward how to do that. So congratulations to that. We also heard, especially in all those 3 feedback sessions, how we need to keep innovating in how we actually achieve good work, and that only by sharing good practice and looking critically at what works and why things don't work and being committed to change it will we get that. And maybe I just pick up an example from the group that I'm in terms of saying innovations in occupational health that link much more to supporting young people in the community when they're in and out of work at different phases in that life is absolutely critical. So that's joining up services within the health sector with other sectors and with community groups. And we heard that across the board. I would add one thing in that I heard a little bit this morning and again now, is that because we're in a special time, we have to look at good work and good health in the context of today and what's going to happen tomorrow. And so we need to look at anticipatory policy and horizon scanning, and particularly when we start to say, well, what kind of employment sectors have been hit by COVID and are maybe not going to recover or recover differently? How will innovations in technology change that, and how will it impact on the availability, the opportunity and the quality that young people have for work? And that means that we need to look at things through the Fair Work Commission and through the Young Person Guarantee Scheme and through active labour market policies on youth responsive investment in good work and good health, and anticipating how changes in the labour market and employment are going to impact on the availability of good work, and addressing that before it becomes a problem. And that means that we won't have to rely on short-term schemes, because we'll be designing our employment and labour markets in anticipation of avoiding those risks. And I think I know that through the Wellbeing Economy, the Future Generations Act, and through the work that you're doing on foundational economy, that Wales is rightly positioned in the European and global arena as a leader nation in how we're doing this. So congrats to Wales for doing that, and we would really like to take the learning from today and share with other countries across Europe. And I guess that what strikes me the most is that the power of today is convening different insights of people who are in the system, benefiting from the system, supporting the system. So whether it be employers, employees, health providers, young people, because no one of us has a full enough 360-degree picture on what the issues are. So today, and the work before it and the work going forward, really builds on the need that we need to have different stakeholder perspectives on the common space. And here it's good work, good health, and that we need to focus on how we address the solutions to that by bringing the different people who have different parts of the knowledge about what those solutions should be to the table. I think maybe they're my kind of final summary comments. Some more practical things just to let you know that from today, the network team will be collating the notes from the workshop, and these will be made available on the Public Health Wales website. We really, really do want to know how the dialogue has been today. Have we achieved what we want to achieve? How easy has it been for us to have a dialogue? So please do use the Survey Monkey that's available to give us your feedback, the evaluation, and that's available in English and Welsh. And you can find the link for that in the chat box. And then finally, if you've enjoyed today, if you feel inspired by today and want to be part of taking this forward and involved in future events that are organised by the Public Health Wales Network, then you can join the link for the Public Health Wales Network, which is in the chat box. And I can just say from my side, I would really like to support the learning and practical solutions on real issues that Wales is taking forward, and as a leader nation, bring Wales together with other countries in Europe who are facing the same challenges, and see if we can really shift this agenda. And if we shift a European and a global agenda, then it supports also Wales again to implement what it's trying to achieve. So thank you very much from myself and from Ethan. Thank you.